Welcome to another edition of the Budde Telecom Files. This time I would like to talk to you about e-health, and in particularly in relation to the national broadband network in Australia and the trans-sector approach that now starts to emerge as an important element in this. By that I mean that if you want to utilize the national broadband network for other things other than high-speed internet broadband, then obviously you have to start looking at applications such as e-health, smart grids, tele-education and things like that. But these sectors are under the control of the government. So the government has to come up with interesting, stimulating government policies that will actually start seeing that these sectors are going to use the national broadband network for the purpose of delivering their services. Now, what we've seen happening in Australia is that the government a month or so ago passed legislation that will see that Australian people will get an e-health identifier. This will make it possible for the healthcare system to actually start tracking the patient's records. One of the biggest problems in the industry is that if you go to one hospital and you need to go to another hospital or see another doctor, then quite often, you get a pile of paper with you, and even when there are electronic systems, they are not compatible and they are not interoperable between the two of them. So it's a real mess in the IT sort of situation of the healthcare environment. So what you need is to unify and to standardize that whole sort of procedure so that you really can have an e-health system that can track the individual patients. By the way, the e-health identifier is under the control of the user, and there is of course full privacy protection involved in that. Now, following the announcement of the government's e-health identifier policy, weeks later Telstra signed a deal with the Royal Association of General Practitioners, and that will see 17,000 doctors being linked via the NBN utilizing the e-identifier. Telstra will actually start developing a range of cloud computing applications for the e-health sort of sector. A couple of weeks later, another interesting deal was signed between the Aged Care Association of Australia and NEC. Again, a similar sort of situation. The Aged Care Association has links with 28,000 retirement villages around the country, and again they will use cloud computing to start delivering services to the healthcare, to these retirement villages. But also they have already indicated they will take that beyond that. They really start looking at applications that we've been talking about for a long time, like monitoring old age people from their home, making it easier for them to stay at home rather than go to retirement villages, therefore increase the lifestyle of these people and at the same time save tremendous amount of cost in healthcare. So here you clearly see that the trans-sector policy of one side the infrastructure, the NBN, and on the other side very strong government policies in relation to e-health can actually stimulate private investors to take the initiative to start developing applications and to move into this very important area of e-health. Thank you very much for listening, and I'm looking forward to talk to you the next time. More information about this topic and other topics you will find at the end of the clip. See you. Bye bye.